Hello everyone, bonjour tout le monde. Welcome to EFA104 on this beautiful Sunday, July 5th. Where are we heading? You know, the more and more you look at the controversy of the facial coverings, and when I talk about the facial coverings, there's the controversy is actually between intergovernmental departments now. You'll see politicians around the world, some of them are starting to stand up and say, look at the data, right? Look at the facts. Look at the actual medical research that was already done on the mask and what it does. And there are some possible adverse effects of wearing a mask all the time that you may be actually catching, absorbing bacteria, viruses, etc. Those that are wearing it all day long. Remember, you're not supposed to touch it. You're not supposed to basically all those requirements of the washing your hands like a surgeon. Don't touch it, put it on, dispose of it if you touch it, wash it if it's a reusable one. All these little things that are happening now, the mandatory, they're starting in cities. They're starting at different parts of the world, mandatory, and then after the mandatory, it's going to go to the fines, right? So, and we've talked about this on previous EFAs, but what if it's unhealthy for you? Remember our previous EFAs, when are they going to start talking about health and pollution, right? Those two things should be talked about instead of covering your face. And what we're going to have extremely unhealthy people with face coverings, right? Like it doesn't make sense. But what if, right? Remember all these different parts of throughout time, stuff that was put out. Mothers, was it? I can't remember that drug that pregnant women were given back in a certain time from the 60s, and the children were born with their limbs basically shortened limbs and etc. Part of, I don't remember the terminology on that, but there's been a lot of these kind of things throughout history, right? And what if they're wrong again, right? What if they're wrong again? Where now we're going to make people sicker, right? The Eric Berg, Dr. Eric Berg, the one that talked about the 80%, that why the 80% are okay with COVID-19, and then Denis Rancourt, Ottawa University, he gives a really good YouTube prison news coverage on that. If you want to look at that one, there's so many great ones, great videos out there. The analogy I heard the other day on Ben Nazati, there, one of his podcasts, and he had a doctor on, and the doctor said the mask is like trying to stop mosquitoes going through a chain link fence, right? There's a lot of experts, a lot of doctors, and some of them are backing it on actual data. Remember previous EFAs I did in March and April, and they said you've already spent hundreds of millions of dollars, trillions of dollars worldwide to prepare for viruses, blah, 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 because of SARS and all that, so the previous ones, but you weren't prepared, right? Well, the same thing is happening with the mask. There's a lot of data already done on that, on wearing facial coverings for a very long time throughout. Like you have hairdressers, all those trades are wearing it for 8 hours a day, right? 10 hours a day, 12 hours a day. And 5 days a week. I've talked about in previous EFAs with those that said, like today, this week in Ottawa, Canada, it's going to be humidex is at what 40 degrees humidex. It's going to be a hot one, right? And and those are going to be on these public sites, construction individuals wearing those face coverings. And I've talked about on previous EFAs those that found themselves that almost fainted. I did investigations for years on construction accidents, right? The slip, trips, and falls, and a lot of them were caused by heat strokes and etc. and so forth. And now you're gonna have people covering their breathing passages while working on job sites at 40 degrees humidex because of law that may be unhealthy for the individual wearing it in the long run. Really, 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 really look at the data. Really go back on history. You've already spent hundreds of millions of dollars probably combined worldwide on all this data. So just crack open the books, review it before you start imposing it ideology-wise or revenue generation-wise. You need money, you're going to go looking for fines and create them at the expense of others. And others, I'm talking to each and every one of you, get out of the medical system. Get healthy. Trust me on that. It'll clear up your mind, your heart, and your soul. You will feel like the sunshine behind me just radiate. I'm not kidding you. You will radiate. Jean-Guy Bourguignon, wishing each and every one of you a fantastic equality for all week ahead of you. Love you guys.